Well, hi. Hello, everyone. Well, I'm just sitting here in the car waiting for my son to get out of school, so I thought I'd talk about something. Okay. So, ladies, I want to talk to you for a second about heart disease and heart attack. Are you in danger? Well, while we know, most of us know the signs of heart attack, which is most of the time the same for men and women. So let's review what the signs are. If you ever start having chest pain or a pain that's in your chest that's not relieved by you sitting down, and you are experiencing the pain, it radiates to your neck, your jaw, your left arm, your shoulder, etc., you need to call 911. So those are some that's obviously sign of danger that you need some medical attention, sign of a heart attack most of the time. So you want to get help. But for women, the signs are not always that apparent. It's not always that pronounced. So we kind of have to watch ourselves to make sure that we're detecting or that we're following up some really subtle signs for women. Some of those can be, number one, indigestion. You feel like you ate something, it's sitting there, it's not going down, like you ate something that's just not settled, or there's a heartburn that you're feeling. That could be a sign of a heart attack for women. Okay. Another sign of just sweating. You're having sweating for no reason. Another sign can be just shortness of breath. Obviously, if you have a shortness of breath, something is going on. So that's another subtle sign. Another sign is just extreme fatigue all of a sudden, and you're just tired. That's a sign. Or if you start feeling lightheadedness or dizziness, or you can also have pain to both arms. That's another subtle sign. So there's some really subtle signs for women, or just even abdominal discomfort can be a sign. So as women, the signs are a little bit more subtle than for men. But obviously, if you start having pain to, both arms, or pain that's radiating to your neck, your jaw, your shoulder, your upper back, you need to call 911. That's an obvious sign. So what do we do? And for women, what we want to recommend, if you didn't know already, heart disease is still the number one killer for women. No, it's not breast cancer, it is heart disease. So we cannot talk about it enough. It is important for women that we continue to sound the alarm, especially when the signs of heart attacks can be really, really subtle. When heart disease, those things, we need to just make sure that we're taking care of our heart. And so, what do? Well, you want to start with preventative measures. First of all, I encourage every woman. I know that most of us are caregivers. We're doing things. We're busy. It is often very difficult or a challenge to take care of ourselves. We're like, okay, we'll take care of it when it's time. Trust me, I've been there. We've all been there. But it is critical that we even do that. So it's important that we take the preventative measures. Number one, making sure you're at least going to your annual visit once a year, where you see your doctor for, comprehensive assessment, and you're getting lab work that is a thorough lab work to make sure everything is okay. There's also, screen you for based on your age and things and immunizations. Make sure that those are up to date. So your once a year annual visit is critical, that you make sure that you're doing that at least. And then if you have blood pressure issues, that you're taking your medication. Don't skip your blood pressure medication. That's not good, because a lot of times you are more of a high risk if your blood pressure is going up and down, up and down. That's what causes the strokes, the rush of the vessels. The pressure is not necessarily the steadiness, it's the sudden back and forth. So don't take your blood pressure medication as just whenever. Keep it on a regular routine, like it's ordered. So make sure that you are taking that medication if it's ordered, and then making sure that you are eating a healthy diet. Yes, the thing that we always say: healthy diet, exercise, good nutrition, rest, and decrease stress, especially for women. Stress, of course, is the number one killer for so many things. It just makes everything worse. Makes the illness worse, and it makes you high risk for illness. So if we can reduce the stresses in our life, I know that's easier said than done, but it is still true. So preventative measures to help us so that we don't get into the complications, or even increasing our risk of having heart disease, heart attack, etc. So that is still the number one for women, because we're so emotional. And a lot of time, what triggers a lot of this heart issues or emotional issues that trigger these things. So women, because of who we are, you have to kind of watch ourselves a little bit more. So I wanted to just sound that reminder to us, since I'm just sitting here waiting for my son to get out of school. So, okay, talk to you guys later. Ladies, have a wonderful day, and be sure to take care of your heart. All right, till next time. All right, bye-bye. Feel free to comment below. Bye.